Hey there, I'm Dr. Vlad, a general pediatrician specializing in autism for children. Speech problems are the top reason that families with autism seek specialist evaluations. But not all speech problems are related to autism. We've all heard the stories about speech challenges in kids. When the mother-in-laws or the grandmas tell us, don't worry, all boys are late talkers, or speaking two languages at home will cause a child not to speak on time. Let's just wait and see until they're 3 or 4 years old to see how much they talk. Well, it's been estimated that about 1 in 5 normally developing children will not develop language skills at the same time as other children their age. And that's a lot of kids. The typical 18-month-old is expected to have a vocabulary of at least 10 to 25 words and would be considered significantly behind if they have less than a 5-word vocabulary. Now, not all of these kids will have persistent delays in their language abilities. The children who will most likely be late talkers include those who can do all of the following. They can point to pictures to identify them, point to show you interesting things, demonstrate imaginative play where they pretend to feed a doll or put a doll to sleep. They can follow two-step commands well, and they have good physical skills like running well and jumping well. So any child who has delayed language skills definitely warrants a hearing assessment. It's usually best to err on the side of caution and obtain a thorough developmental assessment, as what's been done in the past with watchful waiting has caused problems for kids because it causes them to delay the start of necessary therapies. So pointing is actually an interesting skill. 90% of typically developing children will point to ask for things by 15 months old, and 90% of 18-month-olds will point to show you things. Some common signs to be concerned for when a speech delay could really be pointing to autism include those who are 18 months old or older and are not consistently pointing with their speech delay, also don't respond to their name consistently, they make little eye contact, they prefer to play alone and not interested in returning a smile back at you when you're smiling right at them. So remember that one size only fits one. Each child's situation will be unique, so you will need a professional to help you organize more clearly what's happening. You can begin by reviewing the CDC milestone tracker to see how your child's developmental milestones are doing. And keep in mind, if you are concerned, you can first speak to your pediatrician, because there are screening tools such as the MChats, which can screen for autism, and discuss the results with them. And then you can even consider contacting early intervention, which does not require you to receive a referral from a doctor or any other professional. You can contact them yourself if you have significant concerns. So for parents living in New York State, navigate autism with confidence. Call our office and empower your child's development with proven strategies and compassionate care. Imagine your early steps to noticing the warning signs in your child that typical parents would otherwise not be expected to notice could be the reason that your child got early support and optimized their future and development. Imagine you being the living embodiment of that knowledge is power and calling upon all the resources at your disposal to get your child the help that they actually need.